27, I think. And this week's topic is hormones. How did we feel when we got on them? Uh, I have been on testosterone for about 13 and a half months now. Uh, so when I first, prior to getting on it, um, I was a little nervous about things, just just the basic stuff, how I would transition, in society. I was concerned about telling people. I was concerned about, uh, physically the acne, which it's hit me pretty bad. um, I was concerned, I just with health issues in general, pretty much, I guess. Um, and then, of course, once I started it, my first shot was amazing. It was just a sense of just euphoria, um, just knowing that I'm finally going in the right direction. I'm taking the steps to be myself. I was so much more confident just with that first shot alone. It was just really great feeling. All the concerns I had pre-T went away with that first shot, I would say, and I knew that I was making the right decision. Not really nervous anymore. 13 months later, I can't really say that I have any fears or any concerns anymore. It's just nice to, at first it was rough. I didn't pass at all pre-T. My voice didn't really drop till about 3.5 months into the point where I was passing, and even then it was 50-50. I wouldn't even say I started passing 100% till about probably closer to 7 or 8 months on T is when I really started passing everywhere I went, including the gay scene. So it was rough in that sense, but it's really pretty easy now. I feel great. I feel happy. I am seen the way I want to be seen. I chose to take hormones because it was very important to me, and still is important to me, that society sees me as male, as well as I do want the facial hair. I did want my voice to drop. I bodybuild, so I did want to start building the way that I should have always been building. So hormones definitely have made me feel a lot more comfortable with the right way. I did think about going about it, other ways, but I did go to therapy for 3 months, because in the beginning I kind of saw myself also as androgynous. I didn't really see myself as male. I didn't really see myself as female. Hormones definitely changed that. I see myself 100% as male now, without a doubt, and I'm a lot more comfortable living my life as male. I was unsure of that in the beginning. Is this really what is best for me? When you live your life for 27 years as one gender, sometimes, or at least in my situation, it was like, well, is this really what's going on? Is this really what I need? But it was, and it was a good decision. I would recommend anybody to go through therapy, just in case. It's a life. Hormones will change you. It changes a lot. It changes up here. It changes physically. It changes how the world perceives you. They are irreversible changes for the most part. So I would definitely say go through therapy. Make sure that this is what you need to do and what's best for you, because this isn't what's right for everybody. And you can be trans, you can be genderqueer, there's so many different levels of the spectrum that you can be. I know so many people who don't take hormones, who don't want it, or who want hormones but don't want any surgery. There are so many ways. So definitely recommend therapy and finding yourself and figuring out who you are and what you need to be happy, because ultimately it's your life. I wish that I could have felt more happy, more comfortable without taking the hormones and without all the surgeries and stuff, but because it is risky, and it does put you at a higher risk for stuff, but definitely no regrets through and through. So I definitely feel a lot more confident, a lot more self-assured. It's great to be able to talk to women now, Before, I felt like I couldn't really talk to women because they were viewing me as female, and it was just hard. And now I really feel I can talk to women much easier. I can be myself. I am so much more comfortable being myself, and I can get in touch now better with my feminine side than I could as a female. So I think that's pretty cool. Definitely have no regrets. Hormones were definitely a great decision on my part to make. Feel 1,000 times more comfortable being myself, and it's just nice the way society views me and just blending in. So I guess that's pretty much it on the topic of hormones that I have to say. That's pretty much how I felt taking them and how I feel now. So if you're in, I think my gender therapist is great, and if you're in the Tampa area, St. Petersburg area, that area of Florida, I would definitely recommend her. Her name is Dr. Kathleen Farrell. You can look her up. I found her. I looked her up on Google. She has her own, she has a website and all that. So if you're in the area, I'll put her information down there, and you can go check her out. She also has a group for trans men that meets once a month, and I think she has a group for trans women too. Although I'm not 100% sure, but I'm pretty sure she does. So definitely, if you're in the area, she's a great therapist, and she will work with you, and she's just a wonderful person. So therapy is the way to go before you do hormones. It's very dangerous. I had my blood levels checked. I go and get my blood levels checked regularly. I have not had lower surgery, and I still see a GYN, and I mean, it's difficult, it's weird, but it has to be done. When you start hormones, please take care of yourself. That's a really, really, really important. It can do a lot. Get your blood work checked regularly. Go to your doctor. Do all that. Follow up with that, because that's really important. So that's it for hormones, and I guess I will see you guys next Friday.